Good morning, everyone. Thank you so much, Steele. I'm really excited to be here with all of you today and to facilitate this really exciting conversation. So thank you. As Steele said, we're going to talk a little bit about kind of the national landscape as a way to frame the conversation, and then sort of move in to talk more specifically about some of the issues in New Jersey, and then sort of transition to looking at some great examples of work that are happening in your community, and then talking about sort of where do we go from here? How does New Jersey advance from this place? And really want to acknowledge that this is such a unique time. There's so many challenges, facing the childcare sector and our communities and our country at large. We're going to try to learn a lot together, but also to really get in this kind of hopeful, energized mindset that it sounds like many of you brought here today, to thinking about where we might go from here. But I also just want to say I fully appreciate that not everybody's coming with that same amount of energy today, and that this is a safe place for you to say, I need a minute, I'm going to go on mute for a few minutes and take a quick break to process a little bit. We're so pleased that so many of you could be here with us today for this conversation. So thank you. So I'm going to ask Catherine to share the PowerPoint, and I'm going to just start sort of sharing some background information and data to sort of set the stage, and then we'll kind of hone in and get a little bit more precise about what's going on in New Jersey, and some really exciting work that's happening on the ground. And I think, the most exciting part for me is that we're going to hear directly from two amazing family childcare providers in New Jersey. So just for framing out some of the national landscape, I really like to share with people this statistic about just how many young children are having their early childhood experiences in home-based care. Nearly double as many young children have their early learning experiences in a home-based setting. And of that 7 million children, only a small fraction are in licensed family childcare. So many children are are accessing care from a family, a friend, or a neighbor. And then I think it's really important to note that, one of the reasons that myself and our group at Homegrown is so compelled to focus on home-based childcare is because the populations and the communities that we care really deeply about are already here. They're accessing care and having their early experiences in home-based settings. So disproportionately, children from low-income communities, Black and Brown children, Latinx children, infants and toddlers, children in rural communities, those with special needs, and children whose parents work non-traditional hours use and access home-based care. Catherine, do you mind going to the next slide? And then I think sort of really importantly, like, why are families selecting home-based childcare? Many of the sort of assets of home-based childcare have really been lifted up during COVID-19, but I think it's important to sort of keep in mind that this is a preferred setting for many families, and for these reasons. Often families have multiple generations of relationships with providers, whether they're an auntie or a grandmom, or really a community anchor, a member of the community that they've known their whole lives. So they have deep, trusting relationships with the providers and caregivers. Given that it's often very close to home, neighborhood-based, it's convenient and accessible, but there's also a high likelihood that providers and caregivers and families share culture, values, language, and child rearing practices. Most home-based care providers offer care to a broad range of age groups, and that means that children can learn from children of other ages. It means that siblings can be served together in the same place. So not only that moms and dads only have one drop off and pickup, but also that siblings can stay together with each other throughout the day. And also that this enables sort of a continuity of care, that children can stay in the same care setting for many years and really develop those deep, loving, attached relationships with their caregivers. Um, Many parents, particularly parents of infants and toddlers, really like the fact that the care is offered in a home-like setting, and that's really sort of kind of congruent with the experience that the child has at home, that those are intimate and sort of similar settings to where the child is at home. Again, family childcare is really critical for many families who work non-traditional hours. And often for many families, this is the most cost-effective option to gain access to childcare in their communities. Moving on to our next slide. I just wanted to call out a couple of kind of trends from the national perspective that I think are really relevant as we talk and think about kind of the impacts of COVID-19. There are many sort of things to look at, but I just pulled out three that I wanted to kind of hone in on that I think are really important to keep in mind. Firstly, you know, the supply of licensed home-based care has been declining very rapidly over the past 10 or 15 years. And so we've seen that, you know, in these communities, often where home-based care is the only option in childcare deserts and areas with low supply, that care has in fact been declining. And what that may result in is fewer options for families, and particularly for families using subsidies and that need other kinds of supports. There may in fact be fewer and fewer options for them to access. We also know that the nature of this caregiving is really complex and challenging, and that home-based providers work really long hours, an average of 56.5 hours a week, and that they are, you know, typically really undercompensated for that hard work. In some cases, we see that licensed home-based providers are earning 50% less than their center-based peers, and that's sort of in an environment where we know that many center-based providers are also earning poverty wages, right? So the compensation issue is really really pressing around home-based care. And then just another sort of kind of indicator here, there are a few different data points for this, but we are also looking at a population that has pretty low levels of access to health insurance. And I think that's just a data point that I pull out as we think about, you know, how to support this sector during a pandemic, and recognizing that there's really a large percentage of caregivers that may not have access to health insurance, and what a risk that poses to the stability of this care setting. We're going to move on and just talk a little bit about what we're seeing across the country in terms of the impacts of COVID-19. So Homegrown has sort of a network of organizations and partners and consultants and communities that we work with. We also have a we also have a provider advisory group comprised of providers from across the country. And from the sort of inception of the pandemic, we've been really gathering as much information from these communities and providers to understand the impacts of COVID-19. And I want to just highlight a few that have really bubbled to the top through these conversations and through the data that we've collected. Number one is that caregivers and providers are really concerned about their health. They're concerned about the health of themselves, their families, you know, who are living in the setting in which they're providing childcare, and they're really concerned about the health of their families that they serve, both the children and their parents, and in some cases their grandparents, and, you know, the individuals that live in the home with the young children that they serve. Providers are also really concerned about not only the health, but the mental health of children and families that they serve, just sort of recognizing what a confusing and complicated and challenging time this is for so many families, and particularly when there is has been some change in the care arrangement. You know, children that are now separated from their childcare situation and maybe home with parents who are working at the same time, who are also really stressed. Children who, are no longer able to access the same level of socializing with their peers. So we've heard a lot from providers really around the concern around the emotional well-being of the children and the families that they serve. Home-based providers are experiencing significant financial hardship as a result of COVID-19. And there are a few sort of factors to this. In some cases, providers have closed and are no longer receiving income. In most cases, their enrollment has changed significantly. So their ability, their income has changed. In some cases, they may be continuing to serve families, but those families' employment situations have changed drastically as well, and may no longer have the ability to pay what they could before. We also are seeing sort of very disparate access to public support. So despite that hardship, there isn't consistent access to support to kind of reinforce providers. And particularly now as this pandemic has gone on for many months, we're starting to hear from providers that they are experiencing food insecurity, that the families that they're serving are experiencing food insecurity, and also a lot of concern about their ability to maintain their housing, to pay their rent, to pay their mortgage. We've heard a lot from providers around the lack of distinct, specific, and timely information that helps them make good decisions during the pandemic to support their own families and the families that they serve. And I'll just give an example from my state of Pennsylvania. In Pennsylvania, the state issued a notice that all childcare needed to close when we went into shelter in place. And they never differentiated in that notification whether that was related to center-based care or home-based care. And so it took several, the notice did not include home-based childcare providers, but there was no separate notice to home-based providers to say this is not applicable to you. There was no specific, guidance for providers. So there was a huge amount of confusion for home-based providers around whether they needed to close, whether they could remain open, et cetera. And I think we've seen just various examples of that play out throughout the country where, a provider will see a governor making an announcement on television that they have, funding available for cleaning supplies for childcare. But then when they call their local, county office or something, they can't connect with those resources. So just a lot, and also have heard from a lot of providers that they end up having to spend a lot of time and effort to sort of validate information and understand if it's applicable to them, and are often relying on their peers to get really actionable information. And then increasingly, as it's become clear how to the extent that it has, that there are new protocols around health and safety, around drop-off and pickup, around, using masks and certain new health and safety protocols, just concerns around both the feasibility, but also support for implementation is something that we're hearing from providers are areas that, they may need additional support from. So these are some of the issues that we're hearing from providers across the country. We can move to the next slide, which is sort of, again, kind of a broad brush of some of the ways in which providers have been responding and coping during COVID-19. Really important to note that about 69% or 2/3 of home-based providers have continued to operate throughout the pandemic. And we really hear that they're doing this for two key reasons. Number one, just because of their really deep commitment to supporting the families who they serve, many of whom are essential workers, and also because many providers really don't have the financial flexibility to cease operations or to, close for some period of time. So providers have overwhelmingly continued to operate throughout the country. Again, there are lots of attempts to access public supports and private supports with sort of mixed success around the country, right? So, we're going to talk a little bit more in depth about sort of the federal stimulus, but a lot of programs are ultimately administered by the state or by local entities, and in different places, providers have had more and less support. We've heard a lot from providers around them sort of pivoting to ensure that they can continue to meet the learning and emotional needs of families, whether they're, continuing to serve them or not. So we have a provider advisor in California who had 12 kids in care. 6 of them continue to receive support, continue to come to childcare. 6 of them no longer came, but she continued to support those children who were now at home with their families, right? She sent packets home to them. She did sort of FaceTime behavioral interventions at home, to support the families and parents. So, we really have heard just incredible stories of how providers have continued to support the families that they are connected to. Equally true, we've heard a lot about how, providers have supported one another during the pandemic. So I alluded to a little bit of like these informal groups of providers who have really been trying to help one another kind of assess and validate information. And sometimes that can look like, giving everybody a call to say, oh, we found Clorox at the Costco in this part of town. But sometimes that's also sort of helping each other really sort of interpret and make decisions around policy or health and safety protocols. So I think there's a really rich existing sort of tradition among providers to support one another. And we've really seen some of that shine through during COVID-19. And then, we've been really fortunate to work with providers and help connect some providers to the press and to really lift up their voices. And, and there's been really some eager willingness to kind of raise the voices of providers and share their stories right now, so that as we think about what the needs of the broader childcare sector look like, that we don't lose the home-based family childcare provider voice during that, and have just been really heartened to see the willingness of providers to get interviewed, to be profiled in the press and things like that, so that we can raise awareness around the issues facing home-based care. Great. So we are now going to sort of, with that as a frame for sort of the national context, I am now going to turn it over to Colleen Stevens Porsche, the Chief Executive Officer of the 4 Cs of Passaic County, the Child Care Resource and Referral Agency in Passaic County. Colleen will be presenting on the collaborative effort of the Childcare Aware of New Jersey and the New Jersey Family Childcare Providers Association and their work to support providers prior to and during the pandemic. And she will also be sharing some really rich survey data with us to sort of help, describe some of the conditions in home-based and family childcare communities in New Jersey. So with that, I'm really pleased to turn it over to Colleen.
Hi, everyone. I understand that our technical person was going to make an announcement.
I can make it right now, actually.
Okay.
So I just want to interrupt again to just make a quick announcement to please remember to mute your lines as well as turn off your videos if you are not speaking, so you could see the controls at the bottom left-hand corner of your screen. As well, for later on, when we go into breakout rooms, we will need to have everybody renamed to their proper name, so that way we can appropriately send you to the right breakout room. So if you could please rename yourself, you could do that by clicking on participants. Again, at the lower portion of your screen, it'll populate a participant list. You find your name that you're currently under, and if you click on the more button, they'll give you the option to rename yourself. So please remember, mute yourself, turn off your video, as well as rename. Thank you.
Okay, thank you. And so you'll get up the slides for me. Thank you so much. Appreciate that. And good morning, everyone. I am so delighted to be here. As Natalie said, my name is Colleen Porsche, Chief Executive Officer, 4Cs of Passaic County. And I'm also a member of Childcare Aware of New Jersey, CCR&R. It is a membership-based body of childcare resource and referral agencies statewide. And often we refer to ourselves as CCR&Rs in short, because that's so much to say. And later on, you'll also be hearing from another member organization later in the webinar, my colleague in this work, Dr. Beverly Lynn, the CEO of Program for Parents. I'm presenting to you today to share the results of a collaboration between Childcare Aware of New Jersey and the New Jersey Family Childcare Association. To support us in our endeavors over the last couple of years, we secured the services of a national consultant, Mary Beth Salomon Testa. She's nationally recognized and a respected authority on home-based childcare. She works with states, providers, and advocates at the federal level, and her efforts boost policies and investments that help family childcare to thrive. Since we have a mixed audience, but many who are experts, I did want to take a minute for those who may not know us so well to give you a brief overview of childcare resource and referral agencies. CCR&Rs have been operating across the United States for about 50 years. Childcare Aware of New Jersey is a network of the CCR&Rs here, collectively working in 21 counties. Our responsibilities and value are in reaching communities locally and personally, allowing the opportunity for relationship-based work that we know is effective. CCR&Rs have boots on the ground working to support family childcare. If you would go to the next slide, please. So Childcare Aware and Childcare Resources and Referral and Childcare Aware of New Jersey. As a lead coordinating body of CCR&Rs, we believe that it is vital that we listen to and collaborate with family childcare providers for family childcare providers. Childcare Aware of New Jersey is a key part of the solution for childcare and the work to build supply and recognition of high quality family childcare. We think about it this way. So, let's support children where they are by supporting their childcare providers. And here's how we do it: with strategies to support current family childcare providers, strategies to bring unregistered family childcare providers back into the system, and strategies to recruit new registered family childcare providers. Would you go to the next slide, please? The numbers here in New Jersey year over year are dwindling. And so you'll hear me echo some of Natalie's points. It is a challenge nationally too, as you've heard. And one of the things I wanted to point out is that 22% of regulated family childcare providers, that's about 25,000 regulated family childcare providers nationwide, went out of the system from 2014 to 2017. Now let's look at New Jersey. There were 5,000 registered family childcare providers in 2001, and that went down to 3,000 in 2010. Then it went down further to 1,486 in January 2020. Then the pandemic happened, and that closed 346 more. Meanwhile, according to a 2017 report from our partner, AC&J, 3/4 of New Jersey's infants and toddlers don't have access to a center either. And we know these children are somewhere, so there is concern. Despite the declining numbers of family childcare providers, families are still choosing this, whether they're regulated or not. This is about trusted personal relationships and neighborhoods and access. As many of you know, regulation called registration in New Jersey is voluntary. There are many family childcare providers operating across the state outside of our regulatory system. Families are counting on them too. It's not just about the subsidy, though subsidy plays a very important role. What we know is that this is a private pay market. And let's talk about some context, right? Childcare history has always included segregation and inequity in terms of what is available to affluent families and what's considered learning and what's available to poor families or poor and vulnerable families to support work. This is also deeply tied to race and the history of racism in this country. Now, so for some further context, states have choices under the Federal Child Care Development Block Grant, CCDBG, and states also have the limitation of years of too little federal investment. States choose who have to be regulated and what it means to be part of that system, who gets to be part of the subsidy program, how they're paid, if they're in the subsidy program, and those participating in subsidy are a small fraction of the childcare market, both in centers and homes. Finally, states define which families are eligible for assistance and all the details of these experiences. And unfortunately, many people hold a false perception that learning isn't happening in FCC homes. So family childcare is disregarded from investments in learning opportunities in many states. We see the trends and the decline, and there are a variety of reasons why, and there's a chance for us to rethink the approach. Part of it is compensation, and part of it is support. And so it needs to lead to better policies. The issues are really interconnected. We have a chance to talk about compensation for providers, and we'll talk more about that later, but this is crucial. This is the first, middle, and last thing really for the whole childcare workforce, this compensation piece. Would you please go to the next slide? Family childcare was crucial before the pandemic, has been crucial during the pandemic, as you see us note on this slide, and will be crucial in the recovery and rebuilding. This understanding and respect is not a given. They often hear that they're babysitters, that there's not quality, as you heard me say earlier, happening in homes, including aspersions cast on the education of the providers themselves, even sometimes within the childcare profession. Providers have expressed that they feel treated as less than and are disparaged in general. So what was happening before the pandemic? Would you please go to the next slide, slide 5? Before the pandemic, Childcare Aware of New Jersey and the New Jersey Family Childcare Providers Association came together in 2018. We did surveys and focus groups. We did some bridging and listening, and we worked to move things forward. And out of that joint work, we identified the following. We identified a desire to work together as allies to increase the availability of family childcare. We heard our providers saying themselves that compensation is a barrier to recruitment to the profession. They said this both in the surveys and in focus groups. And they identified that peer support among providers is crucial. Next slide, please. Now, during the pandemic, in January of this year, as I said before, there were 1,486 registered family childcare providers in New Jersey. In May, Childcare Aware of New Jersey and the New Jersey Family Childcare Providers Association conducted a survey to better understand the family childcare home landscape and what providers needed for reopening. Among the 1,014 family childcare providers who responded to the survey, 346 closed due to the pandemic, and of those, 218 responded in English and 128 responded in Spanish. These are of the closed providers. The survey found that the closed providers had enrolled about 980 children, of which 471 children were in families who paid for childcare with subsidy. So half of the children are non-subsidy. We want to highlight that because we examine the full landscape of providers, those who accept subsidy and those who don't. And that is a lot of children. Parents and family childcare providers choose one another, and they do that for important reasons that we need to honor. We're grappling with the challenge here in New Jersey and nationwide of how to support those who are not in the subsidy program too. It's a different model and a different approach. We wondered if family childcare providers were caring for children new to them during the pandemic, as everything was upended and we know that families were scrambling. Interestingly, most survey participants indicated they did not enroll any new children since the crisis started. However, about 22% of the respondents reported having at least one school-aged child that is new to their program during the pandemic. It's important to also look at shifting enrollment and consider families' needs and preferences and providers' needs and preferences during and after the crisis, including for school-aged children. We'll have a fact children on where children are soon, so that's coming. So look for that, in the coming weeks and months. What all of you know, and all of us know, is that Congress approved some expansions of unemployment assistance in the CARES Act. That happened this spring, and they made sure self-employed individuals could be eligible for full assistance and also for partial assistance if persons were underemployed. But this has been complicated to implement in states because systems weren't ready for the huge increase in applications under these new eligibility rules, and it's been hard for family childcare providers. Family childcare providers with fewer children in care due to COVID, who as a result have had a significant income loss, are eligible for partial pandemic employment assistance. But of the family childcare providers who responded in English, only 37 reported applying. And of those, only 9 were approved. Only 25 Spanish-speaking providers reported applying for partial unemployment, and only 2 were approved. We believe that too few know they're eligible, even though we put a lot of information out there, and we believe there's some glitches in the state system. And these people have less income, and really they should be eligible. Of the 91 survey respondents in English who said they applied for unemployment assistance, only 45% reported that they received unemployment compensation. The other 49% of the survey respondents didn't apply. And among the Spanish-speaking respondents, only 22 applied for unemployment, and 22.7% of the applicants reported that they received assistance. 75% of the survey participants in Spanish did not even apply. So if you would go to the next slide, please, the recovery, right, and rebuild. There are 2 components in recovery and rebuild. One is supporting families, and let me share with you what that might look like. So with parent anxiety high related to potential COVID exposure, there could be a shift in parent preferences for smaller childcare settings offered in neighborhood family childcare homes. According to the 2017 report from the National Survey of Early Care and Education, 70% of poor children in regular non-parental care receive childcare within 3 miles of their homes. In communities where price, location, and transportation barriers limit childcare options, family childcare meets a critical need for families. Understanding the reasons for closure helps all of us to prioritize the most meaningful strategies to help family childcare providers thrive. Now, what does it look like from the perspective of the providers? And that's the second component of recovery and rebuilding. Among those who responded about the reason they closed, the number one concern that the family childcare providers themselves reported was related to their own health or the health of someone in their household. 68% of the family childcare providers responding in English, and 32% of the Spanish-speaking responders. The second most important reported reason was that families stopped attending childcare. What we know is that the trauma and stress of this crisis weighed heavily for family childcare providers, whether they stayed open or closed. They shared their concerns for their own physical and mental wellness. And 2/3 of the respondents, although they indicated they've remained open, they stayed open because families need them and because they needed the income. So to break it down, just to make sure you get the top 3 points, they need to believe that they and their children would be safe. That's part of what we have to think about in recovery. They need families to return to their program. They need financial support, whether they're in the subsidy program or they're enrolling private pay. And here were some things that bubbled up in the survey as some concrete things just under financial support. They talked about startup or restart grants to perform super cleans or to plan activities and have training and information on health and safety best practices so that they can ensure that they know how to best protect themselves and the children in their care. Also cleaning grants related to specific purchases such as masks, gloves, disinfectants, and other cleaning related products. And then they also, that what came up is grants instead of loans. There's a high concern about the ability to repay any loans. And some things are in play now, but just at the time when we did the survey, those were some of the things that came up. Another key point is that they need clear and supportive communications. And let me give you some example. Directions and procedures and guidelines specifically related to registered family childcare programs and appropriate to the home-based childcare setting. Another example is advice to organize the program space and move through the interactions of the day while maintaining the physical distance guidelines and the cleaning and sanitation needed. And then the other key point is they need regular access to supplies beyond PPE. And you heard some of this also in Natalie's presentation. And let me give some examples. Food generally and milk, no touch thermometers, toys and activities so children can have their own. Many of the art supplies and toys are now shared. Funds to purchase supplies and time with pay to complete this work before the children arrive back to the program. Let me just say that the union contract is a piece of this, but it is also bigger than this. It's bigger than the subsidy program rates. Really, you know, if we had to capture what we are hearing, it's about really valuing these women and the work they do in our neighborhoods and to make early care and education possible. I want to emphasize that we must support family child care providers and their programs in all settings. We must support these women and empower them, and we must compensate them. In closing, we have an opportunity to do better, to figure this out, and to re-envision how this can work. Compensation, support, and a safe space for providers and children. Thank you very much.
Thank you so much, Colleen. That was really super insightful data. We are now going to turn to what I'm sure will be the highlight of our discussion today, which is a conversation with Beverly Lee and Shernette Frey Palmer. So I'll ask Beverly and Shernette to come off, to unmute themselves and come on the video. Both of these women are really leaders in New Jersey's home-based childcare community and serve in various roles and on the association. But for the purposes of the conversation, we're really going to ask them some questions about the experience of being a family childcare provider, just in general, and particularly during the COVID experience. So I'm going to just ask a few questions, and I'm going to ask Beverly and Shernette to just share their perspective and their feedback. So I'd really like to start out with a question, which is, why did you become a family childcare provider? And Shernette, if you're comfortable, I'd love for you to start us off in responding to that question.
Sure, no problem. Good morning, everyone. Hope everyone is being blessed today. One of the main reasons why I did choose to become a family childcare provider is because at the time I was a single mother, and as a single mother, I was working and going to school, and there were I believe there wasn't the quality care that I felt that was required for my children's development. It was not available. So knowing that and seeing that as time progressed, I decided that's the route I wanted to go in, because I wanted to provide that to my families and ensure that the children were getting the best care possible.
Awesome. Thank you so much, Shernette. Beverly, would you like to share with us your story of becoming a provider?
Okay. Good morning, everyone. As Cecile said earlier, I'm Beverly, family childcare provider, North Plainfield. I am Vice President of New Jersey Family Childcare Providers Association, Regional Representative for NAFCC, New Jersey and New York, site board member, and I achieved my Grow New Jersey 5-star program. I decided to become a family childcare provider. First, I came out of the corporate world to become a preschool teacher. After being a preschool teacher for 4 years, and a family worker in the preschool for 1 year. And then I attended my local CCR&R family childcare orientation. And then at that point, I really realized that I wanted to open up my own family childcare business. Because with me, I had the opportunity of working in a center, and I just felt like if I opened up my own business, I can do better. I can offer better. I can, not to knock anyone, but I'm just saying that I felt like the children needed more. And I felt like if I opened up my childcare business, that I can offer that to my children and my parents.
Awesome. I think that, you know, for those of us, although there are a lot of experts on the call today, but for, you know, even early childhood professionals who don't spend a ton of time in home-based childcare, I think there are maybe some myths or misperceptions. And I think, you know, I'd love for you all to answer this question. What would you want everybody on this webinar to know about home-based childcare? Sharnette, you want to take that one first?
Sure. Well, first of all, home-based childcare for myself, from my perspective, it offers that intimate care. It offers that one-on-one for the children's social and emotional development. You can be more patient. You're definitely going to be more loving, because it's a smaller group, a smaller entity. And as I referenced before, it's more intimate, you know, and that's really the biggest key. You can really do more with that small group. And that's why I believe that family childcare is ideal, especially for, you know, they're the forefront and they're sponges. And at that time, you really want to be able to, you know, work with them the best way possible. And in order for you to do that, the small setting helps you to really relate to them and have them to relate to you in the same way, the same capacity.
Great. Thank you, Sharnette. Beverly, what would you like everybody on the call and the webinar today to know about family childcare?
Okay, for me, it's basically the same what Sharnette said, but for my personal childcare, being a child, what I would like for people to know is a home-based childcare is personalized relationships that allows for one-on-one environment where children can grow and learn in a small childcare environment. Home-based care also allows special relationships between parents and family childcare providers. As we know, it's just important to have that partnership. It is not just a transition, but it's a true partnership. Because we know if we partner with our families, that's to benefit our children, the children in our environment. That's their growth. That's their, you know, when they see positive, that's what they learn, positive. So like with me, each drop off, pickup is, you know, we share what is going on in the program. The families just do at home when they're at home, and we just, you know, we just bond like that. And then my program also is served as a home away from home. Also for my program, well, for family childcare providers program, focus on the growth and development of each individual child. It is important that we help prepare them to be successful citizens. And in our small environment, we have nothing but the opportunity to do that. And that's basically it. Because I always thought of, at the age that we're serving, we know that as providers and child care educators, that we're going to either break them or we're going to make them. So we want to do the best we can so that they can be able to survive when they move on to their next level.
Awesome. So before we move on to our next question, I just want to kind of hard underline these two, reflections from Shernette and Beverly. All we know about early brain development and the importance of attachment, one-on-one relationships, is so critical. And there's really a unique opportunity in home-based care for those relationships. And I also really want to underscore the opportunities around having relationships with families, right? So this, the intimacy of the setting and the ability to really share and learn and communicate and be a part of a family is really unique in this setting. So thank you. Those were really beautiful reflections. So we're going to kind of shift a little bit, and I'd love for you all to share with us a bit about your experience during the COVID-19 pandemic. How did you operate? What changes did you need to make? And sort of what are the challenges that you have encountered during, this really difficult period? Shernette, I'm going to go back to you to start us off, if that's okay.
That's not a problem. So the pandemic has hit me financially to a point because first of all, I did not mention this, but I do run 24 hours and I have stayed consistent to that. Now running 24 hours, I also provided transportation to and from school, to and from home. So that was another portion of where our finances came from, which was a very good, a good bit of our financial makeup. With that being said, because that piece is no longer a part of the entity, that really hit me quite a bit. So financially, I was hit with that, in that segment. Because I'm unable to provide, I'm no longer available to provide those services, I've had to find other means to try to make up because, one of the things that you discuss is financially, we're not really compensated the way that we really should be. And with that also, what has changed is the way things look now, because now we're wearing masks. There's certain requirements that we need to wear masks. The parents used to be allowed to come inside. That's no longer the case. Now we have to stop well, the good thing about it, prior to the pandemic, we've always taken temperatures at the door. So that never changed. Sanitizing before they come in, we have them sanitize their hands, then they come in, they go straight to the bathroom, they wash their hand with soap and water. All of that was already in place and a part of our handbook before even the pandemic. So we didn't change too much, but the fact that that personal one-on-one communication with the parents being actually inside the daycare, that has really affected. And I've noticed it you can see the distance in between the parents. So what I try to do is I try to keep everything where I do a lot of Zoom meetings with them just to kind of keep them posted, let them know what's going on so they can still see what's going on in the environment, still see the environment so they can have a little comfort. Because right now, one of the biggest issue with my parents is safety and security. While they know that we do what we do and they appreciate what we do, where they could physically see it before, now there's a distance with that. So that's how it's actually, the pandemic has really affected us, and it's something that we're working through.
Wow. That's a really awesome pivot that you've made to be able to ensure that parents continue to get timely, information, and that you maintain that strong relationship. That's really amazing. Thank you. Beverly, would you like to share a little bit about your experience during COVID-19 and how you've had to make changes and have responded?
Well, for me, I closed my program the second week of April due to the pandemic because my husband is an essential worker with New Jersey Transit. And I was concerned for the safety of the children because he's around, his co-workers. And So I was really concerned for the safety of the children and the families I serve, as well as for my household. And but for me, I have signed contracts with each of the families to ensure payment during emergency closures. So that didn't impact me too bad. And due to a strong relationship and communication that I had with my parents, they continued to pay me. Even when I asked them, I felt uncomfortable about it, but they chose to do it because they felt like we are family. And since they were home, but the children were not with me, that they were getting paid, so why not pay me? So that was a blessing. So therefore, I didn't really have to apply for any grants or funding. But however, I am concerned about my family child care providers during this time, because wherever, like whether or not they have subsidy children in their care, there's still a need for support. They still need that financial support. So what I did, I just tried to always be on webinars where I can help them. And as far as my parents going forward now, of course, we don't have that one-on-one contact. But they come and visit, and we meet outside, and they bring the children. And so we just set up dates where I can go to their environment, to the children's environment, because I thought they would enjoy that. They would love to see me there at their home, in their environment. So basically, that's it for me,
Great. Thank you both so much, not only for the incredible work that you do on behalf of the families you serve, but for your leadership and for sharing your stories with us today. I think it's a really powerful to hear directly from your experience, many of the things that we've been talking about. So I'm going to give you a round of a hand, ask everybody to give you a round of applause sort of through the Zoom. But thank you both so much. We really appreciate you sharing your experience with us this morning.
You're welcome.
You're welcome.
Great. So we're going to sort of shift a little bit and talk about some of the supports that are available. I'm going to ask Catherine to put the slides back up, and then we're going to sort of, I'm going to give again sort of a big picture landscape, and then we're going to talk with Beverly Lynn around how some of this is playing out locally on the ground in New Jersey. So as sort of a backdrop, I think there are a couple things I want to pull out, which, we've really sort of hit on a little bit, but, number one, kind of reliance on home-based childcare, both that providers have really been there supporting families through the pandemic, but also this piece that Colleen started to talk about, kind of shifting parent, decision-making, and really how we've seen that essential workers have been relying on family, friend, and neighbor care, relative care, and home-based childcare, home-based family childcare during the pandemic, I think is a really important sort of shift in theme. As Seal mentioned, the national narrative around childcare itself has shifted a lot. And we see sort of an emerging importance, respect, recognition of home-based childcare. And I think really this is a moment to galvanize and amplify that narrative. And then also, I think just really, again, kind of emphasizing that the existing assets, the existing setup of home-based childcare is so well positioned to meet the needs of this moment. Small groups, consistent child groups, consistent caregivers, right? These prior relationships, this deep attachment to really provide this kind of emotional and buffering during such a traumatic and difficult time for children and families. And then again, this kind of flexibility during this uncertain employment environment. As Shernette shared, she's a 24-hour provider. For families who are now going to be scrambling even more challenging sort of shift arrangements to maintain their employment, this type of care is just so critical. So I think this sort of, the narrative is shifting, and it is really sort of lining up like a bullseye between the existing strength strengths and opportunities of home-based childcare and the needs of families during this moment. We can go to the next slide. We're going to get a little bit more sort of tactical here. I'm going to share with you some recommendations around how to support home-based childcare during this time, and then we're going to talk a little bit about some existing supports in the landscape. So our organization put out some recommendations that I'm going to share. I'm going to drop a link to this document in the chat box. I'm also going to drop a link in the chat box to a document that All Our Kin released this week, and there's a lot of sort of shared big picture ideas and recommendations. So hopefully these can be helpful resources as you go into the small group discussion. But just want to sort of share like our thinking about the best ways to support home-based providers. And I think these pull on many of the themes that you've heard today, which is one, kind of meeting the immediate financial needs of providers so that they can continue to operate and stabilizing their housing and economic stability. Using this moment to really build long-lasting infrastructure. Seal said, you know, what's going to outlast this minute? And we really believe very strongly that networks, associations, and sort of infrastructure that brings providers together, connects providers to each other, connects providers to policy and funding, a really critical part of infrastructure that's needed today and infrastructure that will be needed, you know, from here forward. Meeting the physical and mental health needs of families. So some of this relates to kind of these health and safety practices in the childcare setting, but this also sort of relates to these bigger picture ideas of ensuring that both families and providers have access to health insurance, can get tested, and things like that. And also, how do we buffer, how do we support the really the trauma and the emotional health needs of children, families, and providers during this incredibly difficult time. Thinking a bit about the reforming of the supply chain. Colleen talked a little bit about this, but you know, there's really an opportunity to ensure that providers have more seamless, more cost affordable, and ongoing access to the supplies they need to do their job. The supplies that they needed to do their job pre-COVID and the additional supplies that they need now to be successful during COVID. One thing that I think is sort of a bright spot that we've seen throughout the country is that during COVID-19, some states have made some important decisions to increase eligibility thresholds, to, you know, assess payment for subsidy based on attendance based on enrollment rather than attendance. And so we're really calling for states to think about how they might maintain some of these family and provider friendly policies. And then another piece, which, you know, I think is really sort of a nod for the advocates and the leaders in this community, which is a lot of people care about childcare right now. A lot of people talking and, you know, care about home-based providers. We're seeing industry leaders and philanthropy and others really engaged around the issue. And I think the challenge will be for us is how do we keep them at the table? How do we keep them engaged, you know, through the rebuilding, the recovery period, and on into the future? So that's just like a set of very broad ideas. I'm going to ask Catherine to go to the next slide, and we're going to talk a little bit about some of the specific supports that are available. I just want to underscore what I think you heard from our panelists and in the unemployment discussion that Colleen shared. Access to supports, both public and private, is really disparate across the board, and there are lots of different reasons, right? In some cases, it can be, you know, providers' understanding of what they may be eligible, their confidence with filling out certain kinds of forms. In other cases, it can be that they are not eligible or may not be able to, you know, access some of these supports. So, you know, and this looks different in different places depending on who the administrator of these programs are. So in terms of some emergency response, we've been really pleased to see that across the country there has been relief funding that's been provided by philanthropy. Homegrown is tracking about 20 funds across the country that are supporting home-based childcare providers. And then some of those dollars, and we're going to hear from a local example, are not only providing relief funding, but other types of supports to providers to gain access to public support and other types of support they may need. And then we saw a number of things coming through from the federal government, particularly in the CARES Act, but also sort of alongside that, some flexibility and guidance from the Federal Childcare Office around how some of those dollars might be used as they go down to the communities. So the Paycheck Protection Act is the small business loan product that home-based providers, that individual sole proprietors can take advantage of, and it is a forgivable loan, or a mostly forgivable loan, to support business infrastructure. Pandemic unemployment insurance is an unemployment support. We know that many providers have, both center and family child care providers have sought. And in some cases, like here in New Jersey, there's an option to use that as a partial unemployment for providers who have seen changes in their enrollment. And then within the kind of CARES for the Child Care Development Block Grant, there are a number of ways that states are using those dollars. So many states have set up granting programs to use those dollars to provide relief grants to providers. Many have used that to reduce co-payments for families, to to defer some of the financial hardship for families. Many have used those funds to pay for childcare for essential workers, effectively increasing the number of families that are eligible for childcare assistance. In some places like Nebraska, Louisiana, and Oklahoma, states have used this funding and support to create onboarding sort of fast tracking licensing for family, friend, and neighbor providers in the case of Louisiana, and in the case of Oklahoma and Nebraska are using childcare subsidy dollars to pay relatives and other informal caregivers who care for essential workers. Some places are using this for kind of bonus and hazard pay types of things. And many states have used the funding to both purchase and provide supplies and PPE, but also to coordinate access to some of those supports. So that's a really sort of like very quick view of some of the resources that are available to support providers during this time. I think that real kind of question is, how do we use some of this to build some of the infrastructure for what we need moving forward, while also meeting these very immediate and very pressing needs? So with that, I'm going to turn over the conversation to Dr. Beverly Lynn, the Chief Executive Officer for Programs for Parents in Essex County CCR&R. And she's going to share a little bit about her experience. And one of the reasons that I really am excited for Beverly to share the work that she's doing is that she has been really successful in bringing a number of these pieces together, sort of thinking about resource access around PPP and food access, leveraging state supports around supplies and PPE, and then also bringing in private philanthropic support for relief funding. So thank you so much, Beverly, for sharing with us the amazing work that you all are doing.
Thank you, Natalie, for having me. I just want to start by saying Colleen started her presentation by saying that the Child Care Resource and Referral Agencies listen to and work with family child care providers. And that was the beginning of our conversation and the work that we started doing around the pandemic. In late March, we surveyed every provider by phone. We contacted them to see if they were open and also what their immediate needs were. And of course, there were some primary needs. One was PPE, cleaning supplies. We had grant money for cleaning supplies, but they didn't have access to it. Food was a challenge for some providers. They would go to the supermarket and not be able to find the food items that they were looking for. And so after we completed that survey, we began to look at all of these different areas to determine how we can assist providers. So subsequent to the survey, we had a conference call. I think we had about 100 providers on that call. In fact, we have 180 family child care providers in Essex County. And so during that call, we were able to provide a few resources. One, we negotiated a relationship with the Newark Public Schools so that any family child care provider that wanted to have access to free breakfast and lunch from the schools could go and pick that up. And we made arrangements for providers who expressed an interest. Two, we had a conversation with our providers about, what are they doing for funding and what can we do to support them. And in the interim, I had a conversation with our local funders to talk about how could we access federal dollars. Out of that conversation, we were able to provide technical assistance through a third party to our family child care providers and local centers as well to assist them in applying for the Paycheck Protection Program. I will say that there were many providers that expressed the interest, but I think between confidence and the word loan, they were not feeling very confident in moving forward with that. But at this point, we do have a number of providers that have received the loan, and we also have technical assistance now to help those providers understand how they manage the loans, as well as make sure that they return dollars and they become forgivable grants. So I'm very happy about that initiative. It expanded to Passaic County, so Colleen was able to take advantage of it, as well as Mercer County. So in addition, cleaning supplies, they couldn't find cleaning supplies, and through my collaboration with Childcare Aware of New Jersey, the state authorized R&Rs to purchase cleaning supplies on behalf of the family child care providers, for all providers that were open. And we've already started that process, and in Essex, our providers are receiving those supplies as I speak. The other challenge, of course, was just the PPEs. And I spoke to a provider the other day. You mentioned earlier about providers sort of teaming up and looking out for each other, and heard a wonderful story about two providers one would go to Costco and one would go to the dollar store or wherever, and then they would call each other and synchronize this shopping experience so that they could get everything that they need. And we saw a lot of that. We really saw a lot of that. One of the things that really pulled at my heartstrings is talking to a provider who said, you know what, I don't want to be open, but if I want to pay my mortgage and I want to have food on the table, I have no choice. So of course, provider safety was really very important. We coordinated a call with our local child care health consultant who reviewed the CDC health and safety requirements with our family child care providers. She also did additional training. We made sure our providers were aware of that so they could understand how to set up their home, the temperature reading, and all the other things that they would need, because at that time we didn't have requirements that were already developed by New Jersey. And so that came in quite handy, and I know that our providers are following those procedures right now. And I think the other thing that I'd like to share is that the subsidy paid throughout the entire time. If they had subsidy children, they could in fact be paid for the month of April, May, June, and now July. That was huge. We had providers that said, if I didn't get this, I'm not sure how I would have made it. So that, and I really thank the state for making that decision. It has kept our family child care providers whole to a certain degree and helped them meet whatever their financial obligations are. And then lastly, training and professional development. We started training in late April. We were shocked at the number of people who were participating in our training experiences and our workshops. And I found that providers want to know more. They've been sharing what kinds of training they want and what kind of training they need. And we're making sure that we're offering that training, of course, virtually, but nonetheless, they are getting it. And we think, that they're pleased with what's been going on. I think that's it in a nutshell. But I just want to say that the health and safety grants are still available for family child care providers if they have not spent up to $2,000. And the best thing is I've been to the store myself and I see more things on the shelves, which is a very good thing. And so we encourage our family child care providers to, if you still need supplies, please, please continue to spend until you reach your maximum.
Wonderful. Thank you so much, Beverly. I think that's just an incredible example of a community leader, yourself sort of bringing together both public and private resources and learning about what your providers need and being so agile in responding to those needs. So thank you. I really appreciate you sharing that with us.
So Natalie, last but not least, homegrown. We applied to Homegrown for a grant to support family child care providers. And we have been able to leverage resources from 4 additional foundations here in Northern New Jersey who will be assisting us in meeting some of the needs that I just outlined. We know that the state funding is available for some folks, but some folks have been open since the pandemic started. They don't have those resources available to them anymore. And so I'm excited to announce that we will be starting our initiative in the next week or so, and we'll be reaching out to our family child care providers to let them know what they'll have access to.
Wonderful. Thank you so much, Beverly. Really appreciate that. Great. So we are going to keep it moving because now we want to spend some time in some small groups and really kind of dig in a little bit. So I'm going to tell you a little bit about kind of the broad brush of our small group discussions, and then Dani is going to share some of the details of how we're going to work in small groups. The planning group for this call was really clear that we weren't going to just walk away with some short-term goals, that we were going to think big and do some visioning. So as you all come together in a small group, you're going to sort of ask the question, how can New Jersey create and sustain a high quality, diverse, and stable family childcare system? What do we need to realize this vision? What can we do right now to set New Jersey on a path to realizing this vision? And what opportunities exist in response to the pandemic to build trust, further develop relationships with providers, and to get New Jersey rolling? So with that, I'm going to turn it over to Dani, who's going to give us instructions on how to join our small groups and to take notes during these discussions. Thank you.